Matthew Perry's cause of death has been released. Buprenorphine is an opioid-like drug used in the treatment of opioid addiction as well as acute and chronic pain, according to Perry's 29-page autopsy report obtained by USA Today. There were no signs of fatal trauma and no foul play suspected, according to the report. The autopsy, conducted the day after his death, describes Perry as a 54-year-old male with history of chronic obstructive pulmonary disease, emphysema, diabetes, drug use in past, reportedly clean for 19 months, heavy tobacco user for many years but currently not smoking, on ketamine infusion therapy with most recent therapy reportedly 1.5 weeks before death. The medical examiner makes note that the amount of ketamine, a dissociative anesthetic, found in his system was as high as 3,540 nanograms per milliliter. Levels for general anesthesia are typically in the 1,000 to 6,000 nanograms per milliliter ranges, the report notes. Though Perry was reported to be receiving ketamine infusion therapy for depression and anxiety, according to the report, the ketamine in his system at death could not be from that infusion therapy, since ketamine's half-life is 3 to 4 hours, or less. What is ketamine treatment? Sharon Osbourne says ketamine helped her depression. Perry was 54 years old when he died October 28. He was found unresponsive and face down in the heated end of his pool, according to his autopsy. The Los Angeles Fire Department confirmed to USA Today that firefighters responded to Perry's Pacific Palisades home at 4:07 p.m. that day and found an adult male unconscious in a standalone jacuzzi. A bystander had brought the man's head above the water and gotten him to the edge. Then firefighters removed him from the water upon their arrival. A rapid medical assessment, sadly, revealed the man was deceased prior to first responder arrival. Nicholas Prange, an LAFD spokesperson, told USA Today in a statement on October 30. According to his autopsy, there were no pills, drugs or medications found near the pool. He didn't have alcohol or drugs such as methamphetamine, cocaine, heroin and fentanyl in his system. Ketamine is an FDA-approved anesthetic, and over the past few decades, it's also been hailed for its fast-acting antidepressant effects. In 2019, the FDA officially approved esketamine, or ketamine nasal spray, for depression, specifically major depressive disorder with suicidal ideation and treatment-resistant depression, meaning that at least 2 alternative antidepressant treatments failed. Dr. Nolan Williams, an assistant professor in Stanford University's Department of Psychiatry and Behavioral Sciences, previously told USA Today that it's unclear exactly how ketamine affects mood, because there are many mechanisms happening at once.